Hello everyone, so today we will be talking about an MCQ that is associated with the ophthalmology MCQ, and this is my second video on MCQs. This is particularly important for the USMLEs, step 1 and step 2 CK. So here we have a 23-year-old male presented with a trauma to the right eye. The right eye has decreased visual acuity, pain and excessive tearing. Examination shows tear dropped. This is a really big clue. The teardrop shaped pupil and a positive relative afterpupillar defect, RAPD. So what is the next best step? First, we have to know what is going on here. So it's a trauma resulting in teardrop shaped pupil and RAPD. So remember, whenever you see like a teardrop shaped pupil, that's open globe injury. So there is for example, it could be penetrating trauma where the foreign body kind of literally penetrates through the cornea, and that causes like gush of fluid out of the eye, and that causes sudden decrease intraocular pressure. So that is open globe injury. So then teardrop shape open globe injury, just remember that. And it's an emergency. It's an emergency condition. So then RAPD. So let's talk a little about RAPD. So RAPD, it can happen with anything that damages the optic nerve. For example, optic neuritis, glaucoma, trauma. So all of these can cause optic nerve damage, and they cause RAPD. So what RAPD is that, let's say we have the right eye, we have the left eye, and this is the pupil. So if you, let's say this is normal. So normally what happens is that if you show light to this right eye, and then move that light to the left eye, what happens? So first, if you show the light to this, it will constrict, and then also this will also constrict because of the consensual light reflex, right? And so because in the central brain, these optic nerves are eventually the pathways are connected. So if you show the light to this, it will constrict, and this will also constrict. And then when you show the light to this will now constrict, and constriction of this will constrict that. So this is what happens normally. But let's say we have this right eye is damaged, right? The optic nerve here, it is damaged. So, and this is this is sort of the left eye. So if you show the light to let's say you show the light to this, it will constrict, and this will also constrict, right? And but if you show the light to the right eye, which is affected, rather than constricting, it actually dilates, and the opposite constricts. So that is what relative pupillary defect is, and this is because of the optic nerve damage. The optic nerve here is damaged, so you don't get that constriction. So that would be RAPD. So now, what is the answer? It's the tonometry. Remember, it is open globe injury, so tonometry and fluorescein will not be the right options, because here there is a rupture, right? And a tonometry, obviously, there's already decreased pressure, right? Because of all of the fluid is out, all of the aqueous humor is out of the eye because of the open globe injury. So this is also contraindicated. It will further kind of damage the eye. Fluorescein is also contraindicated because there is a corneal defect, so it can enter into the eye. So fluorescein, tonometry, not right options. IVIG you do for this is also wrong. You do this for example, if there is a optic neuritis attack, you first give steroids, and if there is no response to steroids, then you give IVIG. This is not optic neuritis, this is trauma. So emergency ophthalmologic, this would be the right answer for open globe injury. You do eye shielding, you do this, and then you give IV antibiotics. And so that would be the management for open globe injury. And just remember, the biggest clue here is this: teardrop shaped pupil. Teardrop shaped pupil. That is the buzzword. Intravitreal triamcinolone it is used for diabetic retinopathy. But here this is obviously not a diabetic retinopathy, and steroids would not be indicated here. So hope this question was helpful.